So what I'm talking about is financial incentives and health system performance, and I'm going to have a focus on primary health care and really looking at the lessons learned in the Ontario setting. Well, for example, in Ontario, we pay the same for healthy people and for sick people. We pay differently by age and sex, but we don't have any adjustment for socioeconomic disparities or healthcare needs, and we're one of the few jurisdictions that does that. And I think we've seen that we really need to make a mid-course correction and make sure that doctors have incentives and healthcare workers and teams have incentives to look after the sickest patients and not just the healthiest patients. There are numerous current directions. I think in my own field, which I can speak to better in primary care, primary health care, I think we're moving to an era of measurement and accountability and practice improvement, the likes of which we've never seen before. So some of that has been empowered by the new technologies, by the electronic medical records and by the linking of data files and so on. And some of it is just that we're in an era of greater accountability, and so that primary care providers really need to be able to be measured, to be accountable, and to constantly improve. And I find that incredibly exciting. I think that is the future. Also doing planning across health sectors. We've tended to plan just inside health sector silos. And I think the future is really looking at the system as a system. I mean, frankly, we don't have a system in the sense that we have a lot of fragmentation. And pulling it all together as a healthcare system and having people rowing in the same direction in different sectors of the system, I think is the future, together with the technologies, together with the measurements and accountability. And when you see high-functioning health systems, you see they have all those elements. And we've got a long way to go, but that's the future, and to me it looks quite exciting.